So basically you're saying when people drink red wine, that they stop breathing more often than they would otherwise. It looks like. Wow,
it could be associated with any consumption or excess consumption of alcohol. I just noticed with me personally, or my wife did, that red wine would do it, and I've had a lot of patients tell me the same thing.
Wow.
So that's my observation.
Good. So what should people who, let's say, snore, people who kind of feel tired, exhausted throughout the day, people who have some slight inkling that, wait a minute, I'm waking up and I'm already a little not quite here yet, but I slept a fair amount of hours, or it looks like I did. What would you suggest them to do?
Well, I mean, I would have a consultation with them, see how long it's been going on, actually get their symptoms. If their symptoms are relatively strong, or if, like in my case, their partner says that they stop breathing, that's right there is a tip off. If your partner is telling you that you stop breathing for an extended period of time, they need to have the device made. Either the device that can be made from a dentist, and obviously because I've worn one of those and I know that they're relatively comfortable, I'm partial to that. But they need to seek some type of treatment because it can become very severe.
Is there a way to check? Is there a way to check it out? That you hook up some machine and then you know that you stopped breathing or didn't or whatever it is?
There are sleep clinics. Okay, my office, we do not have a sleep clinic in my office, but there are sleep clinics that they can go to, and they actually observe and monitor you while you are asleep. Most of those clinics, as my understanding, they prefer the CPAP type machine, but it doesn't mean you still can't be evaluated by these clinics. So.
Right. And then just people should be aware of that CPAP machine, that wearing that mask with a hose, you need to kind of lay a little more straight than you normally would. And if you're a stomach sleeper and all that stuff, he'll, like a long time ago, asked somebody who has an exercise business and who is one of those fitness guys, and, I know him pretty well. And I said, what's the best exercise? And I was expecting him to say something like swimming or whatever. And he says, Helmut, the best exercise will be the one you will actually do. And
he's right.
Yeah, he's totally right, because it's true. For instance, as a kid, there was not a problem. There was judo, there was bicycling. Well, now I don't do those things anymore. Skiing is the only thing I like, and there are not so many days a year you can go skiing. You know what I mean? So what do I do? The rest of the time, don't exercise much. So you need to find something you like. Otherwise, you won't do it. And the same with that CPAP. Even if it is the best, if you don't wear it, automatically the denture or the insert, the mouth guard, whatever you want to call it, the dentist fixes would become the super best because at least you're wearing it.
That's right.
Good.
That's exactly right. 50% of the devices that we've made, dental devices we've made, are from CPAP wearers who refuse to wear it anymore. So.
Right.
Yeah.
Well, and that's the ones we're already heavily aware of. But really, one of the things I think we both should point out here in this video is that there is people out there, they do have those symptoms, don't know it, don't pay attention. It wasn't heavily pointed out to them.
Right. You're absolutely correct. Absolutely correct.
Yeah. All right. Thank you very much for your informative session here again, Dr. Diez. Bye-bye.